Hi, everyone, and welcome in the Carnival Renaissance podcast. Today, I have the great pleasure of talking with Bitten Jonsson, a world renowned expert in addiction medicine for over 30 years. Bitten, thank you very much for being on the podcast and welcome.
Thank you, Clement. I really appreciate it.
And maybe we could start with you, meaning for people who might not know your work, could you introduce yourself and how you became who you are today?
Well, I'm a nurse since 1973. So many years ago, I did that training. And then I moved to US, and my ex-husband thought I was an alcoholic, which I protested very heavily against. No, not me. But anyway, I ended up in one of the best treatment facilities in the world at that time in California. Capistrano by the Sea was the name, and it blew my mind. This was 1985, and what I got taught, I had never heard of in Sweden. I worked at the biggest university hospital in Stockholm. They never talked about this knowledge about addiction and alcoholism, and that was something that only people with low moral or yeah, they were bad. That's why they were drinking,
Mm.
sort of. But here I learned about the brain, about the illness, about the dopamine system and other neurotransmitters. And they proved to me and showed me the science alcoholism is a brain illness. And I was absolutely floored. And I was angry, angry because nobody told me this before. But
Hmm.
anyway, I got the tools, which is a huge toolbox, to be drug free or sober, as we say, and in recovery, which I worked hard with for 7 years. And then, but during that time, nobody talked about metabolic syndrome, insulin resistance in addiction medicine at that time. We just talked about brain and the alcoholism and how to stay drug free. And being a nurse, I understood that there must be more to it. And I was still
When you say being a nurse, what do you mean?
a registered nurse. I had
Yeah,
my
yeah, yeah.
medical.
But I mean, is there a specific thing when you say being a nurse?
No, what I mean, when I did my nurse training in Sweden and working as a nurse, nobody talked about addiction.
Hmm.
And I can look back and see that we had a lot of clients that have an addiction, but we never addressed it. We addressed the consequences.
So from your practice, you
Yeah,
could,
yeah,
yeah,
yeah.
okay.
From working in hospital, regular nursing in a hospital. But anyway, so I quit that when I got sober. I quit that and started working in addiction treatment.
Okay.
Yeah, which of course is where I wanted to be. But on the other hand, we never brought the medical consequences of the illness into that. It was only talk therapy, 12 step, and that works, but not for everyone.
Hmm.
You know, and I also could see that a lot of people, when they quit drinking, became overweight and diabetes and a lot of inflammation and you name it. But we never put that together or worked with it at that time. So in 1992, I went to a training with an American called Terry Gorski in relapse prevention because
Hmm.
I could see that, treatment is not enough. It's a chronic, irreversible, lifelong illness, progressive. So, of course, you have to have some kind of a lifelong follow up or training like you do with other chronic illnesses like multiple sclerosis or whatever. They had programs, but we didn't. So I went to this training with him for 2 days, and I was absolutely taken back again because he lectured about alcoholics that went to treatment, quit drinking, but didn't do any other lifestyle changes
Hmm.
like physical exercise or changing their food, quit smoking, quit drinking coffee. People don't address those things at that time. But if they did, that group had an 86% recovery rate after 2 years. If they did all the lifestyle changes. But the ones that only quit drinking and went to self-help groups, but did no other changes. They kept smoking and drinking coffee and eating poorly, and they didn't know anything about nutrition. We had no knowledge. They didn't exercise or didn't take care of themselves. They had 28% recovery rate after 2 years. And
Okay.
that was a huge insight for me. So I just connected with Terry Gorski and I said, I want to learn everything from you about all this, about relapse prevention and all that. And then I came back and myself, I quit smoking because I was smoking at that time. Almost every recovering alcoholic smoked and drinking coffee. And I thought I ate good, normal Swedish food. But anyway, so I quit it. And then I realized that I was treating chocolate and ice cream the way I did with alcohol. I was hiding, lying,
Mm.
and sneaking. And I gained weight and I got horribly tired, deprived of energy and, really struggling to function. So I, realized that, God, this is really important to understand. Quitting nicotine, boom, into the sugar.
Hmm.
So, and then I talked to a colleague of mine from US and she said, well, you might be a food addict. And I looked at her like she was from March. Food addict? What's that? I never heard the word. And she started to explain to me. And I think if she had said sugar addict, I would have grasped it faster than
Mm.
food because I didn't really binge eat on cod or cucumbers or, meat or
Mm.
anything in that way. So anyway, so I went over to US again, 92, and did more training in Chicago this time too, and met the people that started treating food problems as an addiction with the same program they treated drug addicts and alcoholics.
Mm.
And it worked wonders. At that time, we had no knowledge about nutrition. So the food plans we had were loaded with, like whole wheat, grains, and low fat, not a lot of protein, fruit, and so on. So, of course, that was a struggle. And we didn't know, we thought it was, more a behavioral thing that we had to stay abstinent with the food, but we didn't have the tools. There were no satiety in that food
Mm.
plan. And then in 2005, but I kept working at it. And I started, of course, feeling better when I quit chocolate and ice cream. So people started asking me, what have you done? What do you do? How do you look much healthier and so on? And I said, well, I quit sugar. Quit sugar? Why? The brain needs sugar. Ooh. Oh, it was on that level. And when I said, bread is sugar, they thought they should put me in jail or something. That's like swearing in church in Sweden. Bread is holy. So anyway, I listened to this Swedish doctor, Annika Dahlqvist, who had started going on a low carb diet because she had gained weight. This was 2005 in Sweden. I mean, it was based on Atkins. I'm sure you know about
Mm. Yeah.
Atkins. So anyway, but in Sweden, of course, Atkins was very dangerous. But she started eating that way. And she lost weight and she started going all over Sweden, lecturing and all that. So I lived very close to her. So I started going low carb in 2005. At that time, I would say it was a liberal low carb.
Mm.
Mainly what it included was what I don't eat today, which is some dairy products that I know will stall weight loss or increase insulin, like whipped cream, cheese from cow's milk, yogurt, sour cream, and that stuff. Which then I removed that later on because I saw that it caused craving in somebody like me, a sugar addict. So I kept working on that, and then I started straightening up, going more strict low carb, and then I think it was 2015 or 16. I killed the last yummy yummy that I had in my food plan, which was nuts, because I
Okay.
learned that nuts was absolutely terrible for you and caused inflammation with all the
Mm.
omega 6 and by this time, I started to dwell more into nutrition, but the modern nutrition, the keto, the low carb, the strict low carb, insulin resistant. But I had started to talk about insulin resistance and leptin resistance and adrenaline resistance in 2008. But, people looked at me like I was a UFO, an alien. Nobody talked about it at that time. So, because I read, Mastering Leptin book, maybe you have read that one. Yeah, I read that one early on. And I kept reading and learning. And also what I did, I put pieces together from all the different disciplines because, today in the medicine world, we are highly, highly specialized. I used to joke and say that the kidney doctor doesn't know where the brain is, and the brain
Yeah.
doctor doesn't know anything about microbiome. That's a little joke, of course, but there is very, strict walls between different disciplines. They don't really marry. And that started to be my aim early on with integrative functional medicine too, to include that. I did that quite early. And of course, it made much sense that you heal the body with the most, with the fuel that the body is supposed to take in. So that's how that
Yeah.
started.
Okay.
And learning about a lot of breathing exercises and supplements and physical activity, how important that is, and sleep. And we started adding all those pieces there. So, and I think from 2016 and on, I was doing the keto diet and I felt marvelous. I mean, that was the best ever to eat in that way. And I found out very early that I will not treat vegans. They eat only carbs. So how can you treat the sugar addicted vegan? It's impossible. So I said no to them. And I've never been, vegan oriented. I'm a meat person. And I also tried carnivore. So I would say maybe I eat keto carnivore. So that's how I eat today. And I have, as a Swede, about twice a year, I eat a little bit of potatoes. It doesn't
Okay.
bother my body
Yeah.
today, but
Okay.
we have certain, like the sour fish, if you have heard of that. Swedes are
Yes.
crazy about the sour fish. We have some potatoes with it. That's more like a cultural, traditional thing. But other than that,
But
I eat a lot of meat, fish, eggs, butter, ghee, olive oil, MCT oil, coconut oil. So those are the things that I eat today.
but one day I went to a bookstore and
Yeah,
I wanted to offer that to a client, a book about cooking.
yeah, yeah.
And there are
Good.
many, let's say, cultural cookings book, like Asian or
Oh
Thai,
yeah,
or,
yeah,
and then I found a Scandinavian book. So I was very surprised that almost all the recipes were about fish or meat. And
yeah.
meat,
I know.
in
Yeah,
my mind, I had a preconceived about fish because you have a lot of water around your countries. But then it was a lot of meat, actually. And I was like,
oh
huh,
yeah.
okay. So just to
And good
relate to
meat
what you
like
said.
reindeer meat and elk and moose,
Mm,
wild game. Oh
yeah.
yeah, yeah. But I grew up on meat, so meat and fish and that type of and eggs.
Hmm.
That's the type of food I grew up on, and so that's basically what I eat: plain food like that. But I want to mention what you say about recipes. I'm not going to have any recipes in my next book
Hmm.
because I think that's like the wheels that kids have on their bike, the extra wheels
Yeah.
to help them learn to bike. If you keep collecting recipes, I'm talking about sugar addicts now.
Hmm.
They become obsessed with recipes, but they
Yeah.
don't cook well.
Yeah.
So, I always say to people today, take a cooking class or ask everybody around you, how do you cook your eggs? How do you cook your meat? How do you cook fish? What's the oven temperature? Pa, 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 pa.
Hmm.
And then learn to cook. Don't, use recipes as your crutch.
Hmm. Yes, I see.
because you get obsessed with. I also joke and say, if I come to people's house and they have lots of cookbooks, I said, "Oh my God, it's a diagnose."
All right. So since I've switched my lifestyle into a keto carnivore one, I studied so many things about the negative effect of sugar and its toxicity. Let's say the biochemistry and the pathophysiology of it.
Right?
But in comparison, the topic of addiction and the word itself is quite not spoken about that much, even in the ketogenic space. I feel that when it comes to alcohol and famous drugs like cocaine, heroin, the word addiction is accepted. But when it comes to sugar, there is still a form of silence around it. Is it just me, or do you
No.
feel
So
the
what?
same?
Yeah, okay, I'd love to turn the question around. What do you think that's all about?
Well,
What's the
I have some
idea? What's
ideas.
your hunch?
uh, I think there are some people that manage to keep that word away.
Yeah, exactly. I think it's interesting because I don't know if you know Patrick Holford in England. He's the
Who?
nutrition Patrick Holford.
Uh,
Holford,
uh,
Holford,
okay.
Patrick Holford. He has a site called Food for the Brain,
Uh-huh.
and he teaches a lot. And he teaches, anything from addiction to Alzheimer's prevention,
Mm-hmm.
Alzheimer's, and all kinds of things. It's a good, it's a good newsletter, Food for the Brain, if
Okay.
you want to subscribe to it. But anyway, 2009. I mean, this is a lot of years ago, and I've said this for years and years too. That the amount of sugar addicts is huge compared to I think he said it was 25 million sugar addicts in UK at that time, and maybe
Wow.
500,000 heroin addicts.
Mm.
So you see the discrepancy in the what we deal with. We make a lot of noise about heroin addiction. Of course we should talk about that and deal with it, but that we have 25 million sugar addicts that we don't want to deal with severe consequences
Yeah.
is horrendous. So there is a lot of resistance. And of course, big food is behind that. They make more and more sinister ultra processed food from processed food and so forth. And it's cheap, it's very highly addictive. And also, I think so many people are addicted, both professional people that
Mm.
work with this, hiding it. They don't want to cut the drug out. So people try all kinds of exercises and therapies and, yoga and I could go on to try to minimize the damage of the drug instead of taking the drug away.
Yeah.
Because I think that sugar addiction is the worst addiction of all because it's so accepted. The drug is everywhere around you all the time. And if you're a sugar addict, you have a more sensitive brain when it comes to smell and eyes.
Mm.
So when you see and hear the drug, it causes a physical craving in your brain
Okay.
and you lose control. It's not on a conscious level. I mean, I could say to you now, no, I turn you off now. That's a very conscious thing to do. If somebody would swiff around with a chocolate cake in front of me, my brain would lit up and I have no control over that. I have developed tools to handle that, to not act on it. But you need to work on the tools and not picking up it because
Mm.
it's going to bam you. It's poof. And that is horrible. And that's what the food industry does to us. And then you have these things everywhere. So many people love the drug and some people aren't addicted to it. Bless them. I wish I was one of them that could eat in moderation. I can't. One bite and off I go. That's addiction. Loss of control. But so many don't want to let go. People
Mm.
come to me with all kinds of horrible consequences. You wouldn't believe it. Physically, psychologically, socially, spiritually. And they say, help me. And I start outlining the treatment program. And they realize they have to cut all these foods with all these, flour, sweeteners, sugar, carbs, on and on. And they just say, I can't do it. And they go back in the fog.
So
So
for them, the mountain is too high.
the mountain is too high. But also all these foods are depriving your mitochondria of energy.
Mm-hmm.
That is the trick to understand. So once you start taking in, which you think is 2 units of chocolate or ice cream or bread energy, it robs your body of 3. So it's like a bank account. You put money in, but it pours out more than you
Yeah.
can put in. So your body is slowly declining in energy, and this is on all levels. Then you have another problem. You know that the eating instinct is in your reptilian brain.
Yes.
So the addiction, the neurotransmitter effect is in the reward system. But then you have the reptilian brain eating center. So once you start fighting this non-nutrition food and start getting low, your body go into survival mode. So now the part of the reptilian brain will start saying to you every day, eat or you die, eat or you die. So now you have a horrible, it's not that obvious that those words, but I mean, it's like driving you.
Yeah.
Okay, and then the third thing that is happening, your pancreas, in order to keep up with the carb load, it has to produce a tremendous amount of insulin.
Yeah.
And the more insulin, the faster and the more the blood in the sugar, because sugar in the blood is toxic. It destroys the vessels, the lining. So now you have this high insulin. So it pushes the sugar hard into your cells to protect your brain and your kidneys and, the micro vessels. So what's happening to the energy? Even lower. So you see, it's a sinister
Cycle.
3-point wheeler. Boom, 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 boom. So that makes you feel confused. You don't see how the dots connect clearly. You don't see this. You feel miserable here. You feel a little better when you eat. And, it's on and on. You're fighting. You try new diets, but you don't get the tools to have sustainability. No matter how much grits you have, people around you say, how long are you going to eat that crazy diet? Why don't you be normal, whatever that is. So this is the vicious triad.
Yes.
So if you end up in this, spin around, it's like a black vortex out at sea. It's like the Bermuda Triangle. Poof, sucks you down. And also, since the person themselves, I don't want to be an addict because we have so much negative associations to that.
Yeah.
I love the word addiction. You know why? It's from Latin and it comes from the word addicere, and it means enslaved. I don't want to be enslaved. I don't want to be something, ruling me. So once I understood that and could break those chains, I can say to anyone, I'm an addict. I have no problem with that. No shame, no nothing, because I conquered it, right? Or the more proper thing is to say, I have the illness of addiction. My outlets were sugar, nicotine, and alcohol. Big deal. Chronic. So I deal with it. So it's a brain illness. But, so that is one thing. And the person, then all the surroundings tell them, no, you're not an addict. Take this pill, take this shot, eat these powders, exercise more, up. All these crazy suggestions that's not going to help an addict at all. Nobody tell them you have to take away all these foods that trigger your brain and your body. And
So I guess you've been in contact with many health professionals over the years.
sure.
How do you feel they react to this topic personally and professionally?
Well,
Meaning, is there a gap between what they understand when you talk to them about biochemistry and how they can or could apply it? with patients in the current medical system?
Well, I don't talk. I do a lot of podcasts. I'm not sure who is listening, but I have a lot of medical professionals coming to
Mm,
me and doing my training,
okay.
how to diagnose sugar. And it's like, when they hear this about addiction, when I lecture about all this, most of them have an epiphany.
Mm,
And, I used to ask them in an assignment when they're done, has your view on addiction changed after this training? And they give the most interesting answers. They say, I'm blown away. I never thought it could be this. Now I know how to talk to my clients. One student said it was like entering Matrix. And I thought that's interesting. Uh, and then they start understanding it and they start working with it and do training. But they have a lot of colleagues and people around them that don't want to, um, take it in.
mm,
So because they want to work with a pill and a method and a diet, and you have it. Uh, because working with addicts is time consuming, it's very tricky, it's a very
mm,
complex illness, it's very confusing. So you need to learn a lot about addiction and toolboxes in order to help somebody grow and get on the safe side, which takes a lot of time.
mm,
But most people, if they take time to listen, if they're not shying away because, "Oh, I don't want to work with addiction, that's so scary, I don't want to use the word, oh," they think that they put a stigma on a client. But I tell my clients, I liberate you if I tell you you have an addiction, and
mm,
I teach you about the body and the brain and your how this works, and you are actually caught, and I can liberate you. And
mm,
when they see the results from the tools we use to assess, they start crying and of relief. And they said, my God, I thought this for years, but everybody around me said, no, 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 no. You have this problem, or depression, or bipolar, or, inflammation, or what have you. And those are consequences from the addiction. So most people that work in the field don't like to use that word. They use the word eating disorder,
mm,
or binge eating, or they people eat because they're depressed. And I said, ho ho, you're depressed because you eat wrong. Your
mm,
brain is deprived of nutrition. That's why you're depressed. So you're in a vicious circle. You eat this junk food, you become depressed, panic, anxiety, miserable, blah blah blah, and then you eat and think you ate because of the feelings. So I said I put the horse in front of the wagon.
mm. But okay, here's the way I see things, and I see addiction as the root cause of many things. But many doctors went from, let's say, normal practicing to questioning the metabolic issue and then advocating keto or carnivore. So there is a step in it. Do you feel that in the same way the awareness that the social media is bringing onto the keto carnivore nutrition could enlighten the addiction topic much more at some point
Absolutely.
as a
And this is,
consequence of a research
yeah,
process?
absolutely. And I have harped about this for, almost 20 years, that the addiction specialists must learn about, metabolic syndrome, insulin resistance, metabolic decline. And it's only came the last years. I remember several years ago, I heard about Georgia Eid,
Mhm.
the food psychiatrist. And I thought, am I dreaming? Is there a food psychiatrist? That's like, something I've dreamt about for years,
Mhm.
combining these. So I contacted her and I also met her, and she's lovely. And she lectures in my training, of course. And that's been my motto is connect the dots. Hashtag connect the dots
Mhm.
between these disciplines. Because I think as much as the medical community is not so willing to learn about addiction, the addiction specialist is not willing to learn about nutrition and metabolic syndrome. So we have to marry them. And that's what I've been working on. And I think that Nutrition Network is the first platform for medical professionals. And I don't remember which year I joined and started lecturing that. But, they take it very serious. They understand that if you work with a diabetic, for instance, and if you don't screen if it could be an underlying addiction, nothing you do will help because they will not learn about the food. Because, in the keto world, you have the dirty keto desserts, keto bread, and an addict cannot eat that.
Yeah.
So if we keep eating some of these things, we relapse back into the sugar and flour. So I think that's the best thing that happened the last years, that addiction medicine and keto medicine, or therapeutic carbohydrate restriction, as I like to say today, because it's so much, talk about the keto in the wrong way. But if you use those words, they have to marry and stay together for the rest of their life.
Yes.
Yes.
But if we consider the addiction problem as a root cause that would lead someone to use a toxic substance and as a consequence altering and deteriorating his health, why addiction as a subject has such little place in the medical training?
Because it's much easier to work with diabetes because it's so accepted. Yeah, but the doctors that I train now that start working with addiction, they are wonderful because they screen and diagnose and go straight for it and realize that they can look back at clients they worked with when they didn't have the knowledge about addiction. And many of the patients had an addiction underlying the medical problems, and now they see it and they have a totally different outcome from the treatment. A lot of doctors are afraid of the word addiction because they're not trained in it. They still see it as the bum on the street. They have a hard time seeing all the criteria in the diagnosis manuals, ICD-10 and DSM-5, and connect that to sugar. But that's the easiest thing in the world. We can do that in 10 minutes. So I think that is a problem. And also, I think that many wants to work still with, giving clients the tools of a pill or, something like that. Because it's very hard. We work with sobriety-based treatment, so we don't use pills or things. We use the food, and we use lifestyle changes. And that demands a lot of you as a professional, time-wise and engagement and follow-up on your clients, because relapse is always looming on the top of the head of these people due to food everywhere, cue-induced craving. And people that don't want to give it up, they say, "Oh, but that's silly. You don't have to eat like that. You could start using this." And one thing is for sure, that one bite is too much. 1,000 is never enough.
But what I find crazy when we talk about medical training is that, these doctors go into a 6, 7, 8 years, study. My brother, he's actually in medical school. He's going into a 6th year. And at no point they have a clear understanding of this issue. And then later in their career, if they want, they have to go in the wild and find Bitten Jonsson, for example, and then retrain themselves.
Yeah.
And I find it crazy that I did one of your class in the Nutrition Network, Metabolic health practitioner, but I don't think that they get
how
that.
How do you think pays all the medical schools? Who is putting a lot of money into medical school?
I'm very naive sometimes, so
Wake up.
Okay.
They are funded from both the food industry, like the dietitians training, the food industry, and the pill industry. So, a comment on that question. Why is it so hard to find this knowledge? Because it's been around for years and years and years. Follow the money.
Yeah.
I used to joke and say to people, I think, Coca-Cola company could probably take 10 of their clients on a Caribbean cruise and pay for it. Um, my marketing budget is giving away a book sometimes.
Yeah.
That's all I can afford. So you see the discrepancy, of course, and that is a lot. And also, I started 32 years ago. I used to be out there fighting the system, but that's like, fighting with a windmill or, whatever thing we can come up with. Is my newest thing is to say it's like stopping a tsunami with my hands. It's not going to work. So many years ago, I quit that. I don't fight anymore. So I train one person at a time and hope it swings on the water. And I call it throwing starfish. Do you know the story about the starfish?
No.
Oh, it's a wonderful story to think of when you got bogged down. This is a poem from the 60s, and it's about the South Pacific. I see this beach where I used to live in California, and the storm had blown up hundreds and hundreds and hundreds of starfish on the beach, and they were dying, right? They had to get back in the water. So this young girl, she's walking on the beach and throwing one by one back into the water. And this adult comes by, disillusioned, and said, "Oh, you can't save all these." And she said, "It's not going to make a difference," that person says. And she picks up one more starfish, throw it back in the water, and said, "It's going to make a difference for that one." So that's how I work today.
Okay. So
I'm not out fighting.
It's a different philosophical approach.
Yes. So I only work with people that want to learn and that are, I'm not going to go out and write in the papers and argue and fight. I've done that.
So as a world expert on addiction, have you often been consulted by governments, WHO, public health offices for your expertise?
Are you kidding? No. Are you kidding? No.
Okay.
No, they're not asking for me, for my duties. But professionals do, because 2019 I quit taking clients because I had a caseload that would almost kill me for years because I was alone. So in 2012, I started to train colleagues to take clients. So we have that now. They are on my website if you want to look at that. And then in 2000, when I started training, and then in 2018, people came to me for, internationally and asked, "Can you start the training in English?" And I said, "Sure." So I did that for a few years until I, took my last client in 2019. So I coach people. People contact me and I give them knowledge, but I don't take on clients anymore. I refer them to the people I've trained. But I train professionals. That's all I do at this point.
Okay, I see. Maybe more on a biological level, could you, without going too complex, explain why you're making the statement that sugar is a drug? Because for many people, I think, as you said earlier, they don't necessarily see sugar as a drug. And but you make that statement that it's a drug.
Yeah, me and many more. Yeah. I used to work in the nursery department in the hospital when I was a new nurse in 1973, 74. And there is a blood test you take on all the newborn babies after a couple of days or 2 days. You punch them in the heel and take a few drops of blood, and you test something called PKU. I'm not going to go into that, but anyway, you do that on everybody. This painkiller we gave them was a sugar solution, a 30% sugar solution, because everybody knew that was a painkiller. There is research today. I'm going to have that in my book. I used to talk about it. I have some links. You can Google it. But anyway, so we knew it was, painkiller. And but you need to understand a little bit about a body. It wasn't a painkiller in the heel. Painkiller needs to act in the brain. So what they saw in this research and knew is that when you get a high load of sugar, you get a high burst or release of endorphins, which is opioids. So that's the painkiller effect. So already then we knew that sugar affects neurotransmitters in the brain. And then, take that one step further. If somebody has, we say that addiction has to be part genetic, part environment, and part the drug or the food or alcohol or the stuff. Those three. And it shows when we look at that from addiction medicine that one person could have a high genetic predisposition. You don't inherit an illness. It's not like you inherit the predisposition for your genes to turn on that problem or turn off. It's too complicated to go into, but environment, this is epigenetics, can turn on what we call garbage genes, which make you sick, or good genes when your cells rebuild and renew in your body, which you do all the time. So the problem here then is that one person could have like 70% maybe genetic. Dad is an alcoholic, mom is a sugar addict. Boom. And then, but they grow up in an environment when they don't get a lot of stuff, like the bad food. They might get good food, but they can still become addicted once they hit the drug. Once you start feeding them sugar and things that it's easy to think that flour is not sugar. I love what Dr. David Unwin in UK say. Flour is sugar molecules holding hands. Chew the bread, then poof, they go apart and out in your blood. Sugar. And this is a discussion that goes on and on in the big network of food and sugar addict workers. What is the substance that is highly addictive? They don't understand that you can't find, is it high corn fructose syrup, or is it glucose, or is it That's a silly chase. It's chasing the wild goose, I think. It's carby foods. Foods that become sugar in your body. It could be red beets if you move around a lot with those. So what's happening is that if you have this sensitivity, which could be very low, but your exposure to this type of food is very high, and you are in an environment where you pushed it, you get formula when you're a baby full with sugar, you get all kinds of junk food when you're a kid, a toddler. So you're massive exposure and you become an addict. So nobody can say that you have to have 30% genetic and 40%. No. So it's a combination of genetics, environment, and the drug or the substance. And in all kinds of combinations. So that will start the process with the releasing and the rebuilding of the pathways in the reward system. And it's not only dopamine, which some people think. It is dopamine, it's adrenaline, noradrenaline, it is GABA, it's endorphins. So you have to know that dopamine is the conductor, but it's a symphony of neurotransmitters that just go bonkers. And some become very low, some become too high. So that T-tooler, it gets totally out of whack. You lose the balance. So you're chasing the drug and your body tries to compensate. And we also know that sugar leads to other addictions. Something called sensitivity that the Swedish researcher whom I work with, Professor Jörgen Engel, bless him, saw that, if you take a drug and you use it, you're going to get high tolerance. After a while, your body will need more of the drug to get the effect. So 2 ice creams here, a few months later, you want 4 to feel the buzz. And that will create higher craving. And then one day the drug doesn't work, so you need to go to another drug. So you start drinking or smoking pot or, taking pills or what have you, or gambling or screens. You need something more now because your brain is sort of used to this drug. So we call sugar the gateway drug. And I see a enormous connection, that people that become sugar addicted very early starts doing other drugs later in life.
Okay. Or the reverse, that they can stop something, as you said, and then go into sugar.
But sugar is almost always first. But it's not.
Mm.
Nobody saw the symptoms that you loved sweets when you were a kid. Nobody sort of reacted to it. But when we do the sugar diagnostic, which I think everybody that thinks they have a problem should do, it's the only way to know, am I a sugar addict or not? So then we see it.
So what would you say to parents?
To
To parents
parents.
who have like toddler and like children, and who think that this is okay or sometimes even cute because my kitty likes sweets, and that's how they reward them, with sweets. If you listen to your dad or your mom, here is
I
your
would say
gift.
that was okay when I grew up in the 50s and 60s, when you got maybe a cinnamon bun once a week. Was the only sweets we got. It wasn't that dangerous then. But today, with all the sweets today, the cookies, the cakes, the candy, everything, ice cream, everything is more like a chemical shitstorm today. The ultra processed food, it is extremely dangerous, which will rob the kids of energy and mood swings and create a lot of problems. And then many times they think the kid has psychiatric problems, which they don't. It's a physical unbalanced brain. They need real food. So I would say it's a very dangerous way. And I know so many parents in Sweden that really try not to do this, but then the school pushes it.
Mm.
And not to talk about the sports world, with all the sports drinking and, the sweets and the energy drinks. And it's a real jungle out there.
But is it okay to state that, to make the statement that giving sugar to kids is equivalent to giving them cocaine or heroin or alcohol?
Yeah, well, alcohol, I mean, all of those,
In
yes.
terms of drug
I would
effect.
say, yeah, it's like it could be potentially devastating if your kid has a sensitivity, but it is
Mm.
like giving them drugs, yes.
Mm.
Mm.
Because I've said that to some clients sometimes as a more like a provocative way,
Yeah.
and I can feel that there was a pushback on what I said, that I was exaggerating. I said no.
Yeah, yeah, yeah.
I think
And
it's the
and that's
same.
why you have to be, in order to catch people's attention, if you're too provocative, they're going to turn away from
Yeah.
you. And, I've found through the years it's smarter to be seed bombing. I drop little seed bombs that, well, that's not the best thing to give for a healthy brain and a body. It's better to say that one. And also not push information, let them seed bomb information, and then have them, come back and say, what did you say about insulin? What did you mean? I didn't really understand, because you didn't give enough information. And you make them curious. That's what I mean. You start coming to you and you
Yeah.
throw starfish. Yeah.
Well, when I
So
say provocative, it's because usually people, even though you explain something in a subtle way, because they see the issue, they refuse it. So they want to
yeah,
fight
but
back with arguments. And then
yeah,
there was this study that showed, the dopamine release between sugar, cocaine, and heroin. It's a
yeah,
famous
right.
study. And I said, it's about facts, that you have even more dopamine release. So this is simple fact. So if you give cocaine to your children, they probably have less dopamine release than sugar. So
Yeah, of course they're going to protest because the parents also like sugar. So
mm,
you're rocking their whole world. So, I know that is not the smartest thing to do. To
mm,
be that, I used to be that provocative, and I used to fight out on the barricades, and I used to, write articles and, talk to schools and hospitals and all that. But I found that denial is very, very deep and heavy, and also shame and stigma. And the shame and the stigma, because the parents probably know they're doing wrong. So they feel shame and
mm,
stigma, and that turns off the brain. It turns off the neocortex and the prefrontal cortex, then they're not logic anymore. So it's easier to, catch them with the starfish way of going
yes,
and explain little pieces, because you have to think too that every parent wants the best for their kids.
yes,
So if you start, pointing something like that, they feel that they might have harmed them. So they feel horrible, and then they don't listen.
mm,
So you have to reel them in slowly with things like, how can we improve this? And, how can we slowly think bettering your health, the health for your kids, and so forth.
but I
Uh,
think it's interesting that there are two aspects always related to social aspect, meaning
yeah.
whenever they ask for nutritional advice and you bring the keto carnivore
Hmm.
solution,
Hmm.
the first question, even though they don't protest about the rest of it or the science behind it, they would go, what about socially? How do you manage
Yeah.
that? And
Yeah.
then the that's one. And the second is, yeah, I can do that, but I have kids. Meaning I would do it for myself, but I cannot do it for my kids. So this is the two things I hear the most. And I found out that at some point, if you go to a social event and you just try to explain people what you're doing, you have this protest against you. But once you bring a medical issue and you bring the doctor authority flag saying, oh, my doctor told me I cannot eat sugar for a year because I'm pre-diabetic, then people are very cooperating with you, trying to help you. Oh, let me get some ham. Do we have ham? This
Yeah.
kind of
I
thing.
know. I know. Yeah. I know.
So the relation between, I don't know if there is a relation between addiction and social, in your opinion.
No, but I mean, people that are addicted but don't know that they are addicted, or they haven't had the diagnosis, and they, don't know the toolbox how
Hmm.
to behave in a social situation. That you bring your own food, you ask what's going to be served. You don't make a big deal of it. You don't go in there, with blinking blue lights and say, "I'm a sugar addict. I can't eat this and that." That's the most stupid thing you can do. Like you said, I teach my client, when I was doing clients, to say, well, I have some health issues. I don't talk about pre-diabetes. I don't, because I have had a few health issues in my body. I'm just trying a different way to eat for now. That's all you do. You don't make a big fuss of it.
Hmm.
So we teach our clients that. And also, it's a lot about eating behavior, like, gulp food down. We teach so many tools in the toolbox. It's not only changing the food, because a lot of people think that if you change the food, you fix addiction.
Hmm.
Changing the food is 10% of the whole treatment protocol for addiction. That's how complex the illness is. So you have to understand those things, because your brain has been screwed up, wired, due to the drug and all these years on and off diets and all that. So there's a lot of things to understand and know about these things. So when you help people in that way, turn it down, help give them tools. But also another thing that's very important that many don't do, they don't treat people in group.
Hmm.
Treating one-on-one sugar addicts, that's absolutely useless. That's like chasing a slippery soap in a slippery bathtub,
Okay.
because addicts need to identify each other, identification. They need to talk. And that's why I used the metaphor for many years back about the blue dog and the red dog. The blue dog is your healthy part, and the red dog is your nasty little addict that trying to trick you to eat all the time, or it's very seductive. The red dog is very seductive, and it's cunning, baffling, powerful, and very patient. So we teach them about that. I'm not my illness. I have an illness.
Mm.
That's very important. And then we teach from that perspective. So, okay, how do you do in this situation? How did you do in this situation? They learn from each other because actually, uh, another addict is the best person to explain to an addict. So I always do group therapy, and there are support groups for sugar and food addicts, which is beautiful, where they can listen to others and learn, because that's what we need to do. Because society will not accept, society will not understand, even if we have people say, "Oh, really? What does it mean? And how does that work? And tell me." They can't understand unless you are an addict yourself. How sinister the illness is,
Mm.
the red dog.
And
How
how long?
sneaky.
What is the time frame in average to
Well, the
fully
first,
step out of an addiction,
yeah,
sugar
the
addiction?
biochemical, the detox and the biochemical repair. You're going drug free, and the biochemical repair, with what I told you, the breathing, the microbiome, the sleep and supplements, physical activity, to make that program and stick to it at least 6 months up to 2 years, depending on how damaged you are. And then a lot of people, think that trauma caused their addiction. Addiction is a primary illness, not caused by anything. So you have to treat it separately. Many people that are addicts, any drug, have traumas. And the problem with that is not that it caused anything, but it wasn't worked through. They didn't resolve their trauma because they put, drugs on top of it. So it's buried. So once you have healed biochemically and your mitochondria start humming and you get the energy back and your joy and that's the time to look what is left of my traumas to start dealing with. Or you grew up in an environment that you didn't learn, how to relate to people or coping strategies for stress. So now that's the time to learn these things. Don't start therapy, right away when you are going into abstinence, because most of my clients have been to therapy again and again for years and years, and it didn't do anything because it didn't stop the drug, and you need to repair the brain. Or like Dr. Daniel Amen say, psychiatrist in the US, I love his saying, you need to restore the mental horsepower. There you go. Once you do that and that starts working, that's when you take and deal with your, not social skills or whatever you have to deal with to develop as a human being. So that's the next step. Then it maintenance that relapse prevention is extremely important in the biochemical repair. You start learning risk situations and warning signs right off the bat, and then you go about to develop your best self and
Mhm.
work with that. And then you do that, but you are like an alarm. You have an alarm box for not relapsing
Mhm.
for the rest of your life. Always going to be sensitive, always at high risk for relapse, unless I like what my mentor Terry Gorski said. Recovering from addiction is like going uphill in a downwards going escalator. If you stop and stand still, you go backwards.
Yeah.
So you work on your recovery every day, but of course not the same things, but you develop and you go about life. The
Yeah.
goal is to be happy, joyous, and free.
Hmm.
Hmm.
How do you integrate, or do you integrate psychotherapy in your protocol at some point? as an
Yeah, but I
addition?
don't work with it. I work with addiction medicine. So the ones that need psychotherapy after that healing process I talked about, they go there. We recommend them to go there.
But you do first the healing process and then the therapy.
No, I don't do therapy.
No, no,
I'm not
not
a
you, but no,
psychiatrist.
no, no,
No,
no,
no, no, no.
but
I
you
refer them. I
advise it.
refer them. Yeah,
Okay.
not everybody needs it. Some
Hmm.
people are very do beautiful in the 12-step programs,
Hmm. I
the
see.
self-help groups, support groups. So the people that need to go down the road, they go to therapy if they have some issues they need to deal with. Not everybody does.
But addiction is very related to psychotherapy in the first place. Like,
Yeah, too bad, too bad, too bad,
why
too
is
bad.
that? Because it was built this way, or because?
To me, no, but when they didn't know anything about the brain and neuron, mitochondria, and nutrition, and that type of thing, they thought it was a mental illness. I don't agree with that. It's still regarded a mental illness, but all the mental problems are consequences of the addiction. I think the biochemistry and biological damages create many of the mental problems. So biology comes before psychology in my world.
Okay, but do you? I guess many people disagree with that.
Sure, let them come to me and say that. I don't care. I
Mm.
know what I say.
I know, but
That's my experience. I work with 6,500 clients, and that's the case.
specialized in addiction.
Yes,
Mm.
but many of the psychologists and psychiatrists cannot even spell the word addiction. But the ones that can, they are wonderful because they can work, through these issues with somebody.
Well,
But
hopefully.
people that go to psychiatry for the problem with food, they often get medications.
Mm.
We don't work with medications.
Because the medication would only act on which pathway in when it comes
Well,
to addiction.
any kind of psychopharmaca will not work on addiction. It will work on the consequences. Again, we are there looking at the consequences. Like if you have a diabetes type 2 and you give them metformin and insulin, if the keto carnivore people work with the diabetes, they usually take away all the pills and medications. That's how we work with addiction.
Yeah.
Yeah.
I had a talk with
But
Gary.
it's not that we're against addiction. People that are highly suicidal need to go to the psychiatric hospital. You can't cure that with keto, with the food. So people have lots of consequences, but we refer them to the right place, but we don't treat addiction with psychotherapy.
But I observe a trend. Like, I had a interview with Dr. Gary Fetke
Yeah.
recently, and he said exactly the same thing as you said, and many others are saying the same thing. But it seems that every time a doctor or a health professional realize or wants to work on the root cause, he
Yeah.
kind of has to step out of the usual system.
Yeah. But, think about it. When I started nursing school, they told me that it takes about 17 years for um, science to be implemented in the clinical world.
Okay.
It takes much longer, 25. And, the system is very hard to change. And I think if anyone can change the system, it is Noakes Foundation and Nutrition
Mm.
Network. They are the leaders in the world to do that. I don't see any other uh, organization out there that are and they don't go out and fight the system.
Mm-hmm.
They teach one practitioner at a time. This is exactly the same way I figured out many years ago.
Yeah.
That's why it's so wonderful to work with them because we talk the same language in this.
Mm-hmm.
I don't fight the system. People come to me and want to learn about addiction, and they have all kinds of backgrounds, and I said, fine, you're welcome, here we go. And they go out and spread rings on the water.
Yeah.
So that's what's going on.
So you have a website that we will indicate to the
Yeah, yeah,
viewers of the interview, and you're
yeah.
now training only doctors or
No, no,
nutritionists,
you could say medical
nurses?
professionals and nurses and nutritionists, and people have different backgrounds
Hmm.
and lots of experience, which makes it a wonderful training because they share experience. So I have two trainings. One is I certified people in how to diagnose sugar addiction, so you know what you're working with.
Okay.
Not everybody that looks like they have a problem with sugar are addicted. They could have harmful use. And with harmful users, you could use moderation, eating or moderate. And harmful users eat because they are stressed or sad or angry or cultural and all that. Addiction is a primary illness, as I said. I don't work with harmful users. I think that's boring. I work with addicts. I love working with addicts. But the sugar diagnostic is very, very important for people
Hmm.
to understand: am I addicted or not? And if you're addicted, we give them a curve for their whole life. They see everything in their life and every consequence and every weight up and down, and
Hmm.
so that is the foundation for a treatment plan.
Okay.
So I think that's very important. So I have one training, sugar certification, and one training which is holistic medicine for addiction. That's
Okay.
how you train to work with addicts.
Okay.
Yeah,
Great.
but they're
So
both on my website.
excellent. So I would encourage anyone who discovered you today to visit your website and to get more familiar with your work. Your book is coming out in English
Hopefully,
soon.
hopefully, hopefully soon. Hopefully.
Okay.
I refuse to have a deadline at this point. It makes me so stressed, and I have so much else to do. So, but how do you work now? I'm curious about how do you work. Can we spend a minute on that?
I'm in transition because, to be
Okay.
honest,
Yeah.
as a trainer, we were taught calories in, calories out,
Oh
and
yeah.
as long
Oh
as
yeah.
we train people, they would lose
Mhm.
weight. And
I know.
as long as I didn't have any issue myself,
Okay.
I had no reason to believe other way. So people who would tell me, "Oh, I go to the gym, I do what you tell me, but I don't lose weight," I would
Yeah.
go, "The guy or the woman is lying to me," and probably they don't, or they just binge eat next to it. And I thought it's a matter of will. If you go to train, you will lose weight. And then I reached 35 years old and I started to gain plus 8 kilograms of fat. So I thought this will be very easy for me. I've done endurance sports all my life. I've been plugged into carbs all my life. Very easy. I go to the gym for a month or two and then I will lose that. So after 5 months, I did not lose anything in terms of fat. And then I said, okay, there is something that doesn't work there. So, as you said, denial is a
Hmm.
very big enemy because
Yep.
you
It
can
sure
turn
is.
your head and continue and no, I'm not wrong.
Mm-hmm.
So I thought probably there is something wrong with me.
Mm-hmm.
And then I found out Jordan Peterson talking about the carnivore diet and how he felt better. And the next
Mm-hmm.
video was Dr. Paul Mason.
Oh yeah.
Are you
Yeah.
smarter than your doctor? It's still on
Mm-hmm.
YouTube. And in the presentation he was doing at the Low Carb Down Under, he was showing how insulin deactivate the hormone sensitive lipase.
Yeah.
So then uh, the fatty acid cannot get out of the
No,
adipose
blocks
cell.
them. Blocks them. Yeah.
So you cannot oxidize the fats to use them as energy, and then you cannot lose fat.
Yeah.
And then I understood. I said, "Oh, maybe that's what I'm experiencing." So I changed the parameters of my own experiment. I stopped going to the gym for a whole month. I stopped training, spending so-called calories, and I stopped eating sugar, and I lost 3.5 kilograms of fat. I was like, okay, this works. So let's continue. So then I had the animal products and the vegetables. Then I started to listen to Anthony Chaffee, Sean Becker, Gary Fetke, and others. And I said, okay, I'll try for 3 months without mm, plants. And I felt better and better. And then I did this class with the Nutrition Network just for
Yeah.
my own understanding.
Yeah.
And I thought, oh, that's very interesting. So I pushed that area that I never looked as interesting, because to me, nutrition was just a scam. It was like a diet thing. But you just train and you'll be fine. And I never wanted to be on social media, but here I am doing podcasts about nutrition. So it's funny how things are happening. But so I'm in a transition because I see training as important, to the point that your body needs to move. You need to keep a certain level of uh, muscle mass. It's critical for your health. So if I have to advise training to people now, I would say resistance training. Uh, I do massage therapy for 10 years as well. I see it as a very powerful tool in certain cases.
Absolutely. I agree.
But now I see beyond that. I see that this chronic inflammation, chronic pain, that people come and ask, oh, I have this lower back pain or this knee pain for 3 years. Yeah, I do the massage 1 time, 2 times. But after 3 or 4 hours working specifically with like proper techniques into your joint area,
Routine.
or
Yeah. Yeah.
and
Yep.
you still has this, the inflammation comes from inside.
Yeah.
And driver will be nutrition or the wrong
Yeah.
food
Right.
that you're putting into your mouth.
Yeah. Right.
So now, to answer your question, I'm in that transition of how do I, because people like to put things in boxes.
Yeah. Yeah. Yeah.
So you're a trainer, it's about sports. And sports or fitness has been, I think the idea or the preconceived you have is about losing weight.
I know.
Has nothing to do with health or
Yeah.
longevity or
Mhm.
muscle mass maintaining.
Body image. Body image.
So if you're a trainer, I'm going to talk to you about losing weight.
Yeah.
If you're a massage therapist, you
Yeah.
want to relax or get your pain away.
Yeah.
But this is only fixing short term or the symptom, in a way, in a
Yeah.
non-medical way.
Yeah.
So now how do you come into a more integrative, holistic
Yeah.
approach?
Holistic is the key word. That's what I thought about. Yeah.
So I'm transitioning into this more preventive health coaching,
Mm-hmm.
using
Great.
tools like training, nutrition, and massage therapy sometimes. Um, but I have to say it's a challenge. At first, at the beginning, I think the transition is always the most difficult
Yeah.
when you change. So
Mm.
I'm into that phase now. Yeah.
Wow. Sounds very, very wonderful. And, it's going to be nice to follow you in the future and see where you're heading because, you're probably half my age. So it's your turn to go out there and turn the fire on and help people. I'm going to fade out with my age. I mean, I'm,
Mm.
going to slowly quit working with these things because I've done it for so long. So it's your turn.
Yeah. But as I said to Gary Fetke, and I say that every time I do a podcast with people I've followed worked, I always have a lot of admiration for people like you guys, because I think nowadays with the social media, it's easier to speak about things. There's less censorship, but you
Yeah.
guys had to face like Professor Tim Knox, a
Oh,
long
yeah.
4 years case, or Gary Fetke,
Yeah. Mm.
or you in a way, because nobody wants to listen to you. So you take some risk, you put your skin in the game, and you lose at some point. You can lose it about your money, it's about your reputation. Sometimes it's about your career, and then it takes a lot of how should I say that? A lot of courage and
Yeah, and
honesty.
stupidity.
I would say
That you never
honesty.
give up. Well, it takes resilience and grit. And many times journalists have asked me when they've interviewed me. This is years back when I was working very much live lecture in Sweden and training and all that. Said, can I ask you why in the whole world do you keep doing this work and talking about it and work with clients when you have all these resistance and criticism? And I just looked at the journalist in the eyes and I said, because I know I'm right.
Mm.
That's how simple it was. I was right then and I'm right now. Addiction is real. There's tools to deal with it. You can diagnose this, you can treat it, you can heal, you can have a very happy life. You don't have to die from it.
But I think, and when you say that, many people would see you as, oh my God, this person thinks so much of himself or herself. But science, most of the time, if you really study it, honestly, is 1 + 1 = 2 until maybe there is a new discovery that shows that it's
Well,
different. But
we
as
have
long
the
as,
science. We have the science about addiction medicine. We have the science about the sugar addiction. We have the science.
exactly,
So, it's nothing to argue either. But, I used to take the example too. Nobody have proof that God exists, so you choose if you want to believe or not.
hmm
So, I don't, we have the science about sugar addiction, but still, you can believe that you can have the choice if you want to believe it or not. It doesn't matter how
exactly.
many times I prove it to you if you refuse to believe it, because it, gains you in a way to not believe that. It's your choice. I'm not going to chase you and hamper at you.
You
And I
know,
used to say to people, come back if you're interested. If you're not interested, I'm not going to fight with you. So bye bye. If
yeah.
you are, that's not being cocky. I mean, I lean back on giants like John Judkin. I mean,
hmm
in my book, I'm making the reference list not for books for each chapter, but topic. I have a literature list with the books that was published first. I mean, there's so much old research that shows this, that's been, muddled and hidden because there is money behind that doesn't want you to know this.
Of
And
course.
also people that want the drug. It's not only, the industry's fault either. We want it. We want
hmm
alcohol. We want this stuff.
Yeah. And I
So,
think I think what you say is right. Like, believe. Yeah, I remember an anecdote of I was at a party one day, and a woman came. She was about 60, and she talked to me, and she saw I only had meat in my plate, so she asked if I wanted some. So we ended up talking about this, even though I didn't want to, because it was a party. And then she was very interested, and she was like, "Oh, yeah, that's great." And yeah, my doctor told me the same. And one day I did this for a bit, and I felt better, etc. Oh, my daughter, she studied biology, and she's here, and I bring my daughter to you because she'll be very interested to speak with you. So she brought a daughter, and the daughter was so against this. And it's a party, and I can be very I can seem rigid sometimes when I explain things, but I'm a very nice person, I think, and I'm very patient. So she would ask me one question. I would answer the question. She would go, "Oh, okay, yeah. But what about this?" And I would answer with what I know. She said, "Oh, okay. And what about this?" And this lasted for about an hour and 15 minutes. So I stayed seated and I was trying to answer with my knowledge to her. At the end, she said, "Yeah, you seem to have a lot of knowledge about it, but still, I don't think it's a good idea." And I was like, "Okay, that's okay. If you don't think it's a good
it's your
idea."
choice. It's your choice. Yeah.
At the end of the day, I spent an hour and 15 minutes to give you every answer I could from your questions, from what stops you to believe something, but you still want to believe this thing, so it's okay. And
I used to think about it in this way. I had a thing happening to me many years ago when I worked with alcohol and drug addicts. As a nurse, I give you an example. Somebody come in with a big wound, and we clean it and we stitch it and we put a band-aid on. And it's very obvious that we did something. You can see that, okay,
Mm-hmm.
before and after. When you work with the type of work that I do, planting seeds, the seeds had to grow. You have to fertilize,
Mm-hmm.
and you have to do that. So that is a totally different ball game. And at one point, I was sitting with these parents. Their young son was drinking himself to oblivion, and he was living a very dangerous life. It was very obvious he was an alcoholic, and they begged him to go into the treatment center where I worked. And he got furious, livid. He ran out of the room, and the parents cried because they thought, now he's going to die, and we couldn't help him. And, this was no avail to do this. And I felt miserable. Did I do something wrong? I mean, it was horrible feeling. And then a couple of years passed, maybe 4 or 5 years passed, and I'm going to a support group. And this really nice looking, healthy, fresh guy comes walking towards me. And the thing was that I had said some things to him. That's why he got so angry and ran out. And he comes up to me and said, do you recognize me? And I said, no, never seen you before. Well, and he started telling, remember, when I was at the treatment center, my parents were there, and you said some horrible things to me, and I got so angry. But everybody had tried to talk to me, many other people than you. Your words got stuck in my head and in my heart. So it's because of you I'm here sober. I
Mm-hmm.
hugged him and we cried a little bit. But what I said to him was that, I'm not an alcoholic. I don't want treatment, blah, blah, blah. I said, well, you know that addiction ends in three ways: the morgue, the psychiatric unit, or sobriety. You only have three choices. Either you become sober, you die, or you end up locked in the psychiatric unit. That's how
Mm-hmm.
addiction illness takes your brain in the long run. And that's what made him so angry when I said that. But he said, those words made me go to treatment, and here I am today, sober.
But on the last, okay, that would be my last questions to you. So we talked about the biological aspect of addiction, and I have a big passion as well for social anthropology. So I studied it at some point next to my work. I had a bachelor in it. And so we know that human beings, we do cope or stick to a group rules to belong to the group. So you said the moral aspect of addiction is quite now seen negatively. So nobody would say I'm an addict. But do you think that the role model that you or other people that are speaking more and more can have an influence of at least acknowledging? And by that, I've seen my clients when I started the carnivore diet, they all look at me as, okay, this is another extravagance of him. Okay. And then after 2 months, they're like, are you still doing it? I was like, yeah. And I feel great. After 5 months, are you still doing your thing, your diet? I'm like, yeah. And then they see that I'm sticking to it. I say, I feel great, greater and greater. And they're like, but the first step was, I think it's dangerous. So they affirm it's dangerous. I said, no, it's not. Why? I don't know, but I think that, okay. After 8, 9 months, they keep coming back to it. Different way. Oh, I saw this program on TV. They were talking about the sugar and how it's bad for you. I said, yeah, and yeah, it's very bad. I'm like, yes, okay. I try to reduce it. Okay. After a year, they go, oh, last weekend we did the carnivore meal, the carnivore day with our kids. We just ate and they loved it. I'm like, okay. And after a year and a half, they start to experiencing themselves. I had a doctor, actually, he's a gynecologist. I think he heard me talking about this for a year and a half. I would send him podcasts about with like all the doctors that we know, and we say, yeah, it's interesting. But I would train him twice a week. He still had a little bit of extra fat, and one day he just sent me a picture of 2 eggs, 2 sausage, and 2
Yeah.
steak, right? And he said, "Oh, I started the keto." I said, "This is carnivore already," and he went from normal, standard American diet to carnivore, just like this. I don't know what happened in his head, but he eventually lost his extra fat, and now he feels good. He eats once a day, 1 meal a day, and yeah, he's not.
But that's what I mean with throwing starfish.
Yeah,
You walk the walk and you seed bomb. You don't preach, you don't go and hit them over the head with it, but you do it first. You lead the way.
yeah.
And then, you just do little seed bombs, little poop, poop, poop here.
But there is
So
a social psychology in it.
yeah, but addiction is a brain illness with physical,
Yeah.
psychological, social, and spiritual
Mm.
consequences. So, in order to heal, you have to work on all four legs of the chair.
Mm.
Your recovery program has to include physical health factors, psychological, mental health factors, social health factors, and spiritual health factors.
Okay. I see.
Otherwise, the chair going to tilt.
Mhm.
It's going to be unbalanced.
I see.
Yeah.
That's a nice image to end our conversation.
Sure. Okay.
Thank you very much, Bitten,
Yeah.
for
Thank you.
this great talk. I hope this will help as much people as possible to understand the underlying cause for so
Thank you
many
for doing
metabolic
it.
disease.
Yeah.
And so, yeah, I will put your information in
Yeah.
everything.
And do you send me the link so I can share it?
Yes, thank you very much. Do you use all the social media platforms like X or
Yeah, but I'm very, very bad at it. But I have my assistant go out Instagram, LinkedIn, Facebook, and my website.
Excellent. We'll write that down. Uh, Thanks a lot. All the best to you,
The
and
same to you. And
thank you
good
very
luck
much.
in the future with your passionate work.
Thank you very much, Bitten,
Okay. Bye
and bye
bye.
bye.